What are your thoughts about sex?
Sex is good.
All right, enough said.
It's okay not to want to have sex.
Once or twice in the morning.
Oh my God, come on.
Welcome to another episode of Messy Medicine, where we are colleagues discussing medicine, which is not perfect. We have differing opinions, and sometimes just dealing with all of it can be quite messy. To my left, Dr. Chris Ibikunle. I have Dr. Jocelyn Slaughter here. And to my right, Nicholas Jones. Good to see you, buddy. And I'm Dr. Marc Jean-Gilles. Today's topic, everybody loves this. I know I do. We're going to talk about sex.
Yeah.
It's important. It's
Yes.
enjoyable. It's wonderful.
got
Right?
here.
That's how, yes, God made it for us to enjoy. But sometimes the sex life, womp, 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 just goes down. Chris, what are your thoughts about sex and so forth?
Sex is good.
All right, enough said.
We can spend the next couple of days just talking about this topic. But what the audience are asking is, how do we understand when we have an abnormal sex life?
I mean, it's subjective, okay? So, for example, I'll have patients, they come to me, they tell me, Doc, I don't know what's wrong with me. I just don't want to have sex anymore. Another form will be, Doc, I'll have sex, I'm interested in it, but I don't have an orgasm. And then, of course, there's a smaller subset of that. Well, every time I have sex, it hurts. When we have these patients, we work them up. First things first, we make sure psychologically everything's okay, because depression, stress, anxiety can cause decreased libido. And then two, we make sure medically that they're okay, that there's no underlying factors, no diabetes, no high blood pressure. Are they taking any medications that decrease libido? Because that can also happen.
This is a very common thing that women come in with a complaint of. Sometimes their partners bring them in because they think that something is wrong with them. And I always tell them usually, there's nothing wrong with you. It's okay not to want to have sex. I think that is sometimes a normal desire, that you have no desire.
So that's not normal.
I think it's very normal.
But every day, shouldn't the woman want to have sex every day?
No.
That's
Why
what I
not?
thought.
No, I thought it was that way, no?
No, that's you all, because you all were designed to do that so you could populate the species.
Who are you calling you all?
You all, you three.
Wow.
How often do you see sexual dysfunction in women as opposed to men?
And I kind of think when men, I don't know for sure, but a lot of times their sexual dysfunction can be more physical. But I think for women, it's usually mental. It's a lot of stress involved. If you're not in a happy place or you're not nutritionally adequate, your body is not going to want to have a baby.
Usually, the complaint with men is that their libido has gone down. And of course, we're all men here,
Except me.
except Jocelyn. And if we're going to keep it real,
Let's keep it real.
Look, our testosterone level drops, right? And the refractory period becomes longer. For the audience, that's the time between erections. And a lot of men will complain about that, not realizing that that's a normal progression.
I mean, I think over time to see a gradual decrease in your testosterone level, that may be normal, but at the age of 40, I think that may be a little bit premature. I think we've heard quite a lot about these other factors like these hypertension, diabetes, these medical issues, but I want to know more about, like, let's say a woman comes in to see you, like what exactly can you do to help them have an orgasm
the
or
first thing
increase their libido?
Right. Well, for women specifically, the first thing I ask them is, have you ever had an orgasm? There are a lot of women who have never had an orgasm. And I think for men, that seems impossible, but you need to be able to have an orgasm by yourself. A lot of people don't want to talk about that, but if a person does not know how to have an orgasm or has never had an orgasm, it's going to be very difficult for somebody else to give you an orgasm. And I tell some women, it's honestly okay if you don't have an orgasm. And it's not a sign of I suck or he sucks. Sometimes the man is wanting you to have an orgasm and you're trying to have one and everybody's upset and now you're gonna fake it because you're just tired, it's ready to be over. So I tell you, don't put that much pressure on the orgasm. If you're having fun, if you're enjoying yourself, great. If you can't get an orgasm and he does, but you still had a good time, there are ways, if you really want to achieve that, you and your partner can work together.
What role do you think adjunctive devices like stimulators and stuff like that play?
Those are important. When we talk about the hypoorgasmic patients, right? The ones who can't have an orgasm.
They have the desire, but they cannot.
Right. So this is where they have to explore their bodies, right? So we do what's called behavioral therapy, where, get a vibrator and find your spot. That's pretty much what it is. And communicate with your partner. This is what I like right there to the left, right. You have to communicate.
So if you're, if you're a woman wanted to bring in a device like a fake dildo, some really big, really big like penis, like would you feel like uncomfortable?
I ain't trying to hold no dildo. I'm just being.
No, that's not the question though. The question is, would you feel
I am
comfortable?
not.
Would you feel?
Hell yeah! Have you seen these things?
So you don't care about your spouse's level of satisfaction?
So you'd be okay with this?
So you would grab the dildo. You would hold that thing.
I'm not saying that.
No, you sound like you are.
Don't put I'm the moderator here. I'm asking you a question.
I think that's a great question. I think some men would be offended because basically some people may interpret it. A man may interpret it like, hey, well, clearly I'm not pleasing you enough, so you need to use this dildo. But at the same time, I think you both pointed this out. You just have to figure out what stimulates your spouse.
Now, let's say we work up the patient. Everything seems fine. They want things to get better. There are some treatments out there. So with hypoactive, in women, still testosterone does drive up libido. So you can give testosterone supplementation. As far as hyperorgasmic, let's say they're stimulating their clitoris, they still don't feel it or whatever. In some cases, it's been reported that Viagra can work.
What are the risks involved with giving a woman or a man testosterone?
If you give a woman testosterone, she can get acne, she may grow some hair in unwanted places like her chin. Their blood count can increase, so their blood can thicken, so theoretically that increases the risk of a DVT or blood clot. Same thing with the men. It's also a side effect that men don't want is that if you take testosterone, well, your nutsack is going to shrink a bit. It's going to just shrivel up. So there's things we can do about that as well. We can, mitigate that with HCG and so forth.
If you're a woman and you are using any testosterone, it's gonna have an effect on if you want to get pregnant. Now, here's a question I have for everybody. When we start doing sex comparisons, how many times you have sex? How many times these people have sex? Should you have sex every day? Should you have sex once a week? Once a month? And I just want to hear what you all's take on it.
If you're talking about a number, just at this point, once a week, I'm fine. I'm happy. What's so funny? What's wrong with that? I got 4 kids.
Damn.
That's a lot.
Yeah, that just wouldn't work out for myself.
You ain't got no kids. That's why.
I'm more like once or twice in the morning.
Oh my God! Come on.
No, I'm serious. Like first thing in the morning and last before I go to bed.
Oh my God.
Yeah.
Well, it tells you that there's a lot of variability.
I think at the end, what works for the couple is great. I let my wife know what I want. She lets me know what she wants. We find a happy medium.
Right.
And I'm happy. That's all that matters. Well, we hope that this was informative for you all out there. Thank you for joining us today on this episode of Messy Medicine. If you enjoyed this show and you enjoyed the topic, please subscribe to our channel. Any questions you have about today's topic or any other subjects you want us to address, let us know in the comments below. We'll see you next week.